Desde a antiguidade, grandes líderes das civilizações se reuniam com um único propósito: transformar a saúde através da melhora do acesso. E assim nasceu o FIS, o maior evento de lideranças da saúde da América Latina. A cada edição, o FIS cresce e se modifica. O seu palco foi ficando pequeno e teve que expandir as suas fronteiras. Ele não só conquistou de vez o mundo digital, como agora o FIS 21 vem acompanhado de mais 2 eventos, ampliando cada vez mais o seu ecossistema dentro e fora do setor da saúde. A Iniciativa FIS apresenta a maior experiência da saúde da América Latina, que não fala só sobre saúde. Um lugar onde você vai encontrar as maiores lideranças de diversos setores e empresas, onde durante 5 dias, mais de 20 países, 120 empresas e 200 líderes estarão presentes. Em uma plataforma digital e 3D com realidade virtual e aumentada, proporcionando uma experiência mais imersiva. Serão mais de 80 horas de transmissão ao vivo em 3 idiomas e com interpretação em Libras. De 8 a 12 de novembro. Prepare-se, a FIS Week vai começar.
Good evening.
A estreia de um dos eventos mais importantes e transformadores do ano no setor da saúde. Assim, eu pedi ajuda do pessoal da Iniciativa FIS para estar aqui de uma forma um pouquinho diferente. O Simetria é o primeiro evento ESG do setor da saúde da América Latina.
This is the first digital event in the healthcare sector of Latin America, ESG, standing for Environment, Social Governance. This is such an important discussion that we decided to focus only on that at FIS Week. We have panels on brand value, diversity, inclusion, investments, governance, and many other subjects.
Trazemos agora o governador do Rio Grande do Sul, Eduardo Leite, conversando com José Vilar, presidente da Iniciativa FIS, sobre inclusão, governança e responsabilidade social no mundo globalizado. Não deixem de conferir nossas redes sociais e a Trust. Compartilhem e conectem-se. E agora, vamos para a abertura do Simetria.
Desde a antiguidade, grandes líderes das civilizações se reuniam com um único propósito: transformar a saúde através da melhora do acesso. E assim nasceu o FIS, o maior evento de lideranças da saúde da América Latina. A cada edição, o FIS cresce e se modifica. O seu palco foi ficando pequeno e teve que expandir as suas fronteiras. Ele não só conquistou de vez o mundo digital, como agora o FIS 21 vem acompanhado de mais 2 eventos, ampliando cada vez mais o seu ecossistema dentro e fora do setor da saúde. A Iniciativa FIS apresenta a maior experiência da saúde da América Latina, que não fala só sobre saúde. Um lugar onde você vai encontrar as maiores lideranças de diversos setores e empresas, onde durante 5 dias, mais de 20 países, 120 empresas e 200 líderes estarão presentes. Em uma plataforma digital e 3D com realidade virtual e aumentada, proporcionando uma experiência mais imersiva. Serão mais de 80 horas de transmissão ao vivo em 3 idiomas e com interpretação em Libras. De 8 a 12 de novembro. Prepare-se, a FIS Week vai começar.
Good afternoon, everybody. And hello to our audience across all social networks. It's an honor for me to be here at the Symmetry event, the biggest healthcare ESG event in Brazil. That's what we're going to be talking about today with this young and brilliant governor, the governor of Rio Grande do Sul state, Eduardo Leite. Before I give the floor to the governor, and I'd like to thank him for sharing his time, his intelligence, and his knowledge with us. I'd like to remind you that we have over 20,000 people watching not only the governor, but also the 230 guests who are with us sharing their knowledge. Before we start our panel, once again, I'd like to reiterate my deepest solidarity towards the families of the more than 600,000 people who passed away during the COVID pandemic in Brazil. I think that a moment like this, where we start to discuss the healthcare setting in Brazil, is a proof of commitment and respect towards those who passed away and had no opportunity to have access to good treatment, and unfortunately had no access to the life-saving vaccine. I'd like to convey my warmest regards to all of the family members of these people who passed away, and tell them that we'll continue to fight for science, for scientific truth, and we'll continue to be solidary with all of the initiatives that are aligned towards the same goal. I would also like to pay a small tribute, if you allow me, Governor, a tribute to Albert Sabin. He was a human being and a scientist that brought such a huge experience to Brazil and gave origin to our national immunization program when he discovered the magic drops, as we call them, that would prevent the progression of poliomyelitis. I had several colleagues when I was a child that had polio and had sequela. And this shows that when science walks hand in hand with humanism and the need to contribute to development, there's no reason why anyone would deny science. And I wish, Mr. Governor, that in your state, you can tell the story of this great man, Albert Sabin, because the children who are studying today, they're certainly able to play football and hide and seek and so many other things that children like to do, just because those anti-polio drops were given to them when they were born. And so with that, once again, I'd like to thank you for your presence, and I'd like to thank the healthcare professionals who gave their body and soul every day during the pandemic, putting their lives at risk to protect our lives. I'm a physician, but I no longer see patients. I recognize that my colleagues make me very proud to be part of this professional group. So I'd like to thank everyone, thank our audience, our sponsors. And I was really moved watching this opening video. Probably you were also moved. It's very interesting to see how innovation is coming into everyone's routines. So congratulations on developing this brilliant content that's being distributed on all social platforms. Having said that, good afternoon, Mr. Governor Eduardo Leite. It's an honor to have you with us. The floor is yours. We'll talk about inclusive governance and social responsibility in a globalized world. So you have the floor. Thank you. Thank you, Josier, and I'd like to thank everyone who is watching us. It's surely a pleasure to be here at this meeting where we're discussing healthcare and access to healthcare from so many different perspectives, as well as public policies around a service that must be provided to the population, which is extremely complex and urgent. It's complex because it involves all three government levels, the national level, which coordinates and organizes the unified health system or the public health system, the state level, and the municipal government level, especially in municipalities with primary care under the responsibility of municipalities. And in many municipalities, they fully manage the healthcare services. They also manage medium and high complexity services, where you need to promote governance with the participation of civil society that organizes itself through the health councils, so that we can make better use of resources in a way that is responsible to cater to the needs of the population. It's complex, but it is also urgent. And we just gone through the pandemic, and that made it very clear that the disease never lets you know in advance when it's coming, and the public healthcare system needs to be available and in a full condition of serving the population whenever needed. The demand for access to health services is high, and of course it involves urgent and not so urgent aspects, and we also have to think about how to make that access available. And here we need to involve technology, telemedicine, the possibility of giving support, giving guidance by healthcare professionals and healthcare specialists that can help define who the access should be provided to. Technology can also support us in that regard. And with that, we'll hopefully be able to reduce the lines of people waiting for exams and medical visits. As we were saying before, Josier, if somebody approaches us and we're citizens that have better access to exams and medical visits through the public health system, it's usually hard to gain access to that. After a citizen has access to these services, usually the public healthcare systems, the services are really good. I can speak on behalf of my state, where the services, the public services are very good. We have a large number of philanthropic hospitals in our state, and that really made a difference during the pandemic, where if we didn't have public hospitals directly managed by the government, we would have to go through a public auction process. But since that is not the case, we have university hospitals and charitable hospitals. The state can procure the service and define the number of hospital beds that have to be made available to the population. And the hospitals then will define whether they will purchase equipment or not, of course. But we were able to reinforce our structure, basically tripling the number of ICU hospital beds in our state, so that no one was left unattended without a clinical hospital bed or an ICU bed. during the most critical moments of the pandemic. So since we're talking about governance, we're talking about defining responsibilities in a way that is objective and clear, but at the same time, we need interaction across these agents with an organized institutional discussion with well-defined processes and follow-up of what has been procured and agreed between the parties. And following that with well-defined routines to serve the population. And undoubtedly, the challenge of public health in Brazil and in the south of Brazil lies in this mid-complexity services, especially when it comes to visits with specialists or clinical exams that are needed for you to gain access to high-complexity services. Cities in primary care, there's usually a GP that will identify the type of disease that will require specialized exams and tests so that the patient can be admitted to the healthcare system to define the adequate treatment. And that is where we find difficulties in Brazil in specialized visits and specialized exams. And that's where we really place our bets on technology and the system that needs to be structured. It is a challenge in the public healthcare system, having an integrated system of medical records so that in any healthcare clinic, anywhere where a person goes to get medical care, that the professionals may have access to the medical records of those patients and to better personalize care and integrating information in the database to provide adequate services to these citizens. So technology really has to be better used to better manage these demands, to prioritize what is important. And for that to happen, we need to organize these lines, so to speak, by order of priority. We also have a more specific challenge, which has to do with the pandemic itself, that slowed down and has caused a piling up of exams and medical visits during the pandemic. So we are also working towards expanding in a partnership with the municipal administrations. We'll try to tackle this repressed demand in reducing the lines for the specialties and exams under greater demand, especially now that the pandemic is better controlled. But according to what we said about a globalized world, governance and sharing has all to do with that, sharing information and data and defining the flows and routines in a clear, objective manner for each one of the agents, the parties involved, and defining is a well-structured administration that allows us to monitor if the tasks are being fulfilled by everyone. I used to say that in a strategic planning and when you define responsibilities, it's just like when you use Waze or Google Maps or whatever to find our preferred paths. You see where you are and where you want to go, and it shows you a route, and you monitor that route. Turn left, turn right in 200 meters, and so on and so forth. If you have an obstacle and you have to deviate from the planned route, you'll have to know that you have to recalculate the route. And what I mean by that is that just like we define responsibilities, we have to monitor constantly these responsibilities to identify if we've taken detours, or so that we don't simply find out in the end that we took the wrong path, but rather that we will have to recalculate, reorganize, and plan for a new path due to a detour that was necessary in our initial route. But that can only happen if you monitor constantly. Otherwise, it's like planning for a route in your app and putting the phone away and never looking at it again. If you get lost along the way, if there's a detour, you won't find out. You'll only find out probably when you reach a different destination rather than the destination that you had planned for.
We have these responsibilities. We have to match data sharing and information to make sure that we're closer to attaining our goals and not detouring from the goals that have been outlined originally without generating frustrations to the parties engaged. In the case of health, this demands a routine, the meeting, the sharing, because you have every day dozens of thousands of people that need care. Most cases, they are cared for and well cared for. And when there is only one that is not taken care of, even though it's a small number, considering a large number of people for that person, it's 100%. And for this person's family, well, one failure in 10,000. So it's 100% failure. So this generates anguish, apprehension, demands, and if you do not have a well-established system of management, and technology has to be a great ally. Technology doesn't do anything alone. It will be an instrument, but it has to be fed, to have routines and processes predefined for people that operate the technology so that it can actually help reduce lines and move things forward in health according to the demands of the population. Well, let's turn this into a conversation to contribute to our audience. Very good, Eduardo. Very good to hear your view on governance regarding health. On this, I have been thinking a bit. Well, look, Governor, we're living through the pandemic. And taking part of the pandemic, I think the pandemic, yes, there was a principle that we had a problem of professional training. Not all healthcare professionals in Brazil had the same level or had the same skill level. We had no mapping of professional qualifications in Brazil that could be in line with the needs that patients with COVID required. So we had to learn on the way. A question that has drawn my attention quite a lot is that we have a problem, educational, training, and we also had a science and technology problem. And I've seen very little or almost no involvement from the education ministry and science and technology ministries in the general conduction of problems that we identified as key problems to the success of our fight against COVID. I would ask you, Governor, what have you learned, sir, with this COVID pandemic in your state, and what would you do differently from what you've done up to now if another pandemic comes? I can assure you, I can affirm that most probably there will be a new pandemic at some point. Scientists of complexity, they are scholars, they say that certainly at some point we will have another pandemic. They don't require dates, but they define with certain clarity that this will be happening within a short period of time. We don't know how short. What is the legacy that the pandemic has left for you, a politician, of your importance and your important role? What was your lessons learned? The great difficulty of the pandemic was lack of reliable information of what was going on. Everybody was in the dark at the time. Diagnosis, of course, it was in nobody's government plan. In addition to not being in our agenda, it was we had a beginning process of IT implementation, as we were saying, of having the organized data and systems and databases that could be well structured so that we have sort of, the finger on the pulse, as I say, this daily control on time, understanding whether we have more or less hospitalizations. So we have to roll up our sleeves to have a system up to help us control hospitalizations in the state, how much were due to COVID, how much were not, suspicions, clinical wards, intensive care units. All of that was very unclear, very fuzzy. Today we have panels of public access in a very transparent way. Rio Grande do Sul has always been at the top in the transparency ranking in the websites that assess transparency regarding COVID in the states. We've always had this concern so that it is clear and accessible to the whole of the population, the understanding of the situation, what's the health or the sanitary condition in the state. What's the situation of the pandemic in the states? I've always been an advocate of public policies based on evidence. You cannot just make wild guesses. So you have to be objective. So the more objective you are, less space or room you have for claims or confrontations. Even when we have something scientifically proven, things are actually contested and challenged. So let alone data that is not reliable, the confidence of the manager and the critical situation that requires decision-making that is strict, not so kind that we needed to take during the pandemic. It needs to be backed by sound database and organized that allows us to establish this management plan. That has been, in particular, the challenge the pandemic presented to us. The first moments, I held meetings every day for the whole mornings in the beginning of the pandemic with a large team of secretaries so that we could organize this routine, having a well-structured contingency plan based on scientific data with organized data that would enable us to provide management objectively and clearly of aspects related to social distancing, actually mobilizing hospitals to install new beds, everything that was necessary or has been necessary during the pandemic. It's important for us to move forward. As I said, we have a condition of access to tools and technology that allows us to have this management clear and controlled on services, equipment availability, infrastructure, human resources. All this is fundamental for us to have in a very organized way so that when we have needs in other situations, be it the pandemic, whatever, other disasters, whatever happens, what requires mobilization, human resources, structure, material, inputs, etc. So it allows us to manage that quickly. So where you have a given type of input so that you can actually source it. Where are the professionals? Where do you have installed this infrastructure to make decisions based on a database that allows us to be confident to make this management without making wild guesses? Perfect. Very good to have this executive planning of mapping installed resources, because yes, we were actually facing huge trouble, hitting our heads against the wall. There was no evidence that this could happen or could have happened, although when it started in China, then it went to Europe, US. It took 3 or 4 months to get to Brazil. It's very little time. We always have to acknowledge that it's not easy to organize a map where you have respirators, monitors, who the doctors are. Actually, to organize that, it requires time. And I assume this is a time that you intend to carry out as a planning and have data that may allow you to take action. So as you said, access to hospitals, it's obvious that people get to hospitals, be it public or private. We have very good public hospitals in Brazil. People actually throw lots of stones at our public health system, SUS, but we have very good hospitals indeed to solve their own issues. So contracted, so we have contracting a lot of hospitals and the beds of the private sector so that they can care for the general public via private networks. So the thing is the access in this regulation system. This regulation system is very poor from the standpoint of results. It's a black box. You see, Governor, in Brazil, we have 220 million almost inhabitants, and a bit less than or 50 million have some healthcare insurance. So if people require some healthcare system, they depend on the public system. And then you put your name on that federal government system called SISREC. People wait for 3-4 years for some kind of care, and they die of cancer in the meantime. So we need to have actually the integration of information so that there is no redundancy of requested tests, unnecessary spending, a huge waste that without integration of basic information through a single clinical record or medical. I assume Rio Grande do Sul should be starting something towards this and trying to make this integration. So it is very good to hear you talk about this, because I think that in Rio Grande do Sul state we can have a good pilot project to carry out things. For example, I was reading on the Globo newspaper today that a study, I can't remember from which institution, I can't recall the institution, that this period of schools being shut down took children of primary schools to a situation of real illiteracy. It's not digital, it's a true illiteracy. Children have lost the ability of reading and writing. They've spent 2 years with no classes, only having digital classes. Many times the programs have not been made for distance learning. And that was okay. People made a makeshift solutions to make things happen. Teachers, in a very nice way, dedicated themselves while trying to supply and also make things possible. And they had no modern tools with AI, algorithms, etc., to actually leverage teaching of children in a digital way. What do you think, if we still have time? I know your term is, well, we still have 1 year ahead, but it is a year, and something has to be done for the children that have actually missed school over all this period. What are you thinking about that? What have you been doing about that? We've recently announced a quite robust type of investment to make this recovery of learning. Yeah, there's no silver bullet. Many actually organized and matched initiatives to try to make up for the period in which education was especially impacted, from a scholarship paid to students to lower income families, to ensure that they can be in the classroom. So we're going to pay the 80,000 students of middle school in the Rio Grande do Sul state scholarship of 150 reais a month at trying to keep these youngsters in the classroom. And we've also made an expansion of the hours, or teaching hours of Portuguese and maths, which are the disciplines whose contents need to be most mastered without actually leaving aside the importance of the others. They actually allow for logic, reasoning, interpretation for the citizen, for the students. We have increased the hours of these disciplines, and we actually hired 4,000 additional teachers to be able to reinforce the additional hours of these disciplines we're going to make available next year. We're making a consultation with students to help format a fourth year of what we call our middle school. It's not a regular one, but actually the availability for students that left middle school from sort of reinforcement courses of content that have been compromised. And we're going to have several content courses available for those students next year.
Technology that we're adding, new computers, remote learning platforms. I mean, there's a series of items that we're working on in our state to improve the education, as well as training of professors. We had the support of a private initiative to build capacity among the professors so they can resume their activities. And we're also giving scholarships to the teachers to retrain them to deal with this extraordinary new routine, new reality, as well as an important investment in diagnosis, because to adjust all of these public policies and which content must be reinforced, to decide that, we must have data to support us in our decisions. That's why we designed a process that we called reviewing is good. It's a review process where we go school by school and we identify where the biggest weaknesses are. And in addition to diagnosing that, the management system is also used to support teachers in using that data. Because of course, just reviewing something and putting the review data away is of no use. So we have a technical team to support teachers to let them know that, well, in that class, we identified that this or that type of content is falling short, and letting the teacher know how they can approach that subject and how to help the class recover that. So this assessment process is fundamental if we want to make adjustments in the educational process with what really makes a difference, because we could be tampering with content that is really not that important, whereas the important subjects will be left out. So when it comes to governance, we need to have access to databases and evidences and the biggest weaknesses, so that we can customize for each one of the classes the process to guide them through the recovery of their educational process. Mr. Governor, I know that your time is short. We've probably already abused of your available time, but I'd just like to request from you a few more minutes so that we can wrap up. One of the subjects that's been of concern throughout the world is artificial intelligence and its algorithms that could lead to unemployment and poverty. In addition to that, from the perspective of governance, we also have to provide for social inclusion. And we had the honor to have you at the opening session of our event. This event is about ESG, the environment, social, and governance. We did not talk about the environmental aspects, but we talked about that with Jose Roberto Marinho. So I would like to ask you about social responsibility. How would you say that we should incorporate innovation and technology without causing a disaster, as it seems to have been the case with the Industrial Revolution, with lots of people being thrown below the poverty level. And now the situation may repeat itself. So how could we avoid that? And along with that, what's your idea for us to include Black people and women in the public administration of your state? And what would you recommend for the inclusion of women and Black and brown individuals, which is an obligation of Brazilian society, letting them take on the leadership roles that they're entitled to. So before you go, I would like to see you talk about these two subjects. What is your perspective about how to at least reduce the impact of artificial intelligence that has been causing so much fear among people, and how to make the participation of men and women more egalitarian? Well, I think it's even more serious than what we saw during the Industrial Revolution, because at that time, for one, it was a longer period with a slower transition than the one that we're experiencing now, which is much quicker. The changes are much faster now. And the job positions were being suppressed, but the positions that people had the opportunity to occupy, such as a person who works at an industry or at a plant, they were easier to train people for those positions than the positions that we're now talking about, where people are being replaced by robots and artificial intelligence, but their level of training and skill is much higher. It's not the same replacing somebody that writes computer code. It's much more difficult now than replacing somebody who used to work at a factory floor during the Industrial Revolution. And hence, we are at a greater vulnerability for populism, demagogy, because people are anxious about what they're going to do in this world, and people will start looking for culprits that they can hold responsible for this transformation, and that involves immigrants and whatnot, where in fact, it's not caused by anybody. It's a situation that we're experiencing. So we have to transform our education to create the necessary abilities, logical reasoning, and other skills that are required for this new world, this new economy. We have to train new generations for that, but we're also aware that there is a part of the population to whom there'll be no easy solution. And in that case, the state will have to give support and will have to help, not only in terms of funding, but also in terms of finding new opportunities, taking care of the elderly, or taking care of the parks in cities, because it's not only about transferring income, it's all about giving these people a sense of belonging and a sense of usefulness. So it's not about income only. Of course, it involves income, but it's about giving them a sense of belonging and usefulness. It's a huge challenge. There is no easy answer to that, but I would say that, as you said before, we have to include women, Black and brown individuals, the LGBTQIA plus population, and many so-called minorities that also requires that governments get involved and understand that diversity is a strength. It's not a weakness. The Brazilian people is richer, more creative, and stronger because it's diverse. If we had all the same characteristics, we would only see problems from one perspective. But since we're also diverse religiously, racially, culturally, and whatnot, this makes us more creative. And of course, because of that, governments should foster the participation of these groups through quotas and through policies. We're also advancing in that regard in my state, organizing quotas for the participation in public administration, as well as easy access to credit for companies that have women in the leadership boards. I mean, we have a series of policies that have been adjusted to promote this insertion and a greater empowerment of these groups, and thus help recognize that diversity is a value that must be highlighted and not a weakness that must be combated. Mr. Governor, it was an honor to have you with us. I'm sure that everyone watching us will also watch us on social media, and we're all really glad to see a young politician like you with such a great vision and such a great take on the world. It's really inspiring. We believe that Brazil will be successful, and that's what we're trying to work towards, establishing life conditions that involve solidarity and kindness. So thank you very much. I wish you a successful public and private life. I wish you health and a long life. Thank you.